Okay, and we are live. So I want to welcome everyone to the next installment of the Department of Environmental Health's Your Health series. This is The Silent Killer, Radon Exposure and Your Health. We're joined today by panelists from different industries and universities across the US to talk about radon exposure. And our conversation will be moderated by Dr. Petros Koutrakis from here at the Harvard T.H. School of Public Health, Department of Environmental Health. So welcome to our panelists. First, I'd like to introduce, Longxiang Li. He is Assistant Professor of Environmental Health at the Rollins School of Public Health at Emory University. Dr. Li is a former trainee working with Petros for 9 years and is currently at Emory University, where his research focuses on developing general geospatial models to assess human exposure to environmental stressors such as radon. We're also joined by Dr. Ernani Choma, research scientist here at the Department of Environmental Health, Harvard T.H. School of Public Health. Dr. Choma is a risk assessor and decision scientist, and he develops methodology and models to better assist health risks with the primary objective of informing policy decisions. We're also joined by Dr. Tina Mbanzan, a board-certified allergist and immunologist and pediatrician. She's currently assistant professor of pediatrics at Harvard Medical School and attending physician in allergy and immunology at Boston Children's Hospital. Her work focuses on advancing our understanding of asthma in children, especially looking at environmental exposures and how they impact asthma rates and severity. We're joined by Jane Malone, who's the National Policy Director at the Indoor Environments Association, where she works with industry members to advocate for state-level policies, strengthen radon-related building codes, and obtain congressional and federal agency support for reducing risk from environmental contaminants. We're joined by Stacy Stanifer, Assistant Professor at the University of Kentucky College of Nursing and the Radon Policy Program Director for Breathe, where her work primarily focuses on cancer prevention through reducing environmental carcinogen exposure, including radon and secondhand smoke. And we're joined by Sean Price, who works in the field of radon testing and mitigation, where he oversees the operation of different facilities and also is the chair of the ANSI AARST MEAS standards, which cover the measurement of radon in schools, commercial, single-family, and multifamily buildings. And finally, we're joined by Matthew Bozigar, an assistant professor in the School of Nutrition and Public Health at Oregon State University. He's an environmental epidemiologist who studies multiple adverse environmental exposures, including radon, noise, air pollution, and their health outcomes. And finally, I would like to hand it over to Petros Koutrakis here at the Professor of Environmental Sciences here at Harvard T.H. School of Public Health, who is the co-author of the Radon Map study that recently found that 25% of households in the US may be living with radon exposure over the EPA threshold. So I'll turn it over to you, Petros.
Carly, thank you very much for organizing this webinar, and thanks for the introductions. I'm very grateful to our panelists that accepted our invitation to talk about radon. And also, this was an idea that came from our chairwoman, Dr. Karin Nadeau, who thought that it might be a good idea to have a webinar about radon and try to bring people with different perspectives and discuss this important issue. Today, I will just make a brief introduction, and then I will go around and ask our panelists 1 or 2 questions. And if we have time, we will go for a second round of questions. Radon basically is a gas that emanates from the ground. It's a progeny of uranium and radium, which are solid and they are underground. And when the radon is produced, it's an inert gas that makes its way inside the house, but also outside. A great deal of radon exists outside. Radon was first recognized as an occupational hazard, especially for people working underground in mines and uranium mines and coal mines. And now, more recently, we have recognized radon as an environmental risk, and not just for lung cancer, but for other types of cancers, and for also neurological effects, cardiovascular effects. So there is radon is an emerging field where we see many papers coming out the last 5-10 years underlying the importance of radon. I would like to start with Ernani, who is my colleague here, a research scientist working with us on radon and particle radioactivity, just to give us a very brief state of science. What do we know about radon and its risks? I know it's a very ambitious question, but we just need a short answer. And we'll start with Ernani. Thank you.
Thank you, Petros. Thank you for the opportunity to be here. So very briefly, radon is known to cause lung cancer. So the World Health Organization, the U.S. Department of Health and Human Services, the U.S. EPA, and reports by the National Academy of Sciences all consider radon to be a known human carcinogen. As you mentioned, it was first studied in an occupational setting among miners, mostly uranium miners. And so there have been many of these studies among miners in many different countries that collectively include over 100,000 miners that consistently show that radon has a strong, significant effect on lung cancer risk. Now, you may ask, well, how about residential exposure to radon among the general population? That looks a little bit different, right? And so after those minor studies, there were also many studies among the general population of residential exposure to radon showing strong effects on lung cancer risk. And these were done in many countries, the US, Europe, some in China as well. And so we have very strong evidence of this lung cancer effects of radon exposure. What is not very clear, what we know less about, is whether radon causes other health outcomes. There's definitely studies showing that effects of residential radon on, for example, leukemia, skin cancer, brain tumors. But those are only a few studies, and they have some important limitations. So it's still uncertain whether radon causes these effects. And I think one of the important limitations of these studies is they often knew the exposure levels quite poorly. And that's why having the much improved natural radon model that Longxiang developed, I think is very important to be able to do this further studies of radon effects on other diseases.
So I like to talk a little bit about exposure. As we started around 2016 to submit papers for publication on epidemiological studies of radon, we realized that there was a very strong pushback from the reviewers claiming that our exposure model, our exposure data actually, they are not sufficient. And basically back then, almost 8 years ago, we used the EPA data / Lawrence Berkeley Laboratory, which basically were estimated around late 1980s. And we had a radon average for a given county, no temporal variability. So our team and most of the people at the time, they use this data, which are, according to reviewers, and I agree, they were not sufficient. So I asked Longxiang, because he knows how to deal with large data sets and programming, of course, to construct a national radon model. And the whole idea was to approach industry, the people who make measurements, radon measurements indoors, to obtain all the data over the last 20 years and try to develop a spatial temporal model. And back then, we met Sean Price, from Spruce, who not only helped us with his data, but he introduced us to other industries, and by the end, we collected like 10 million data points. So, Longxiang, a few weeks ago, your paper in PNAS was published on the national model. Can you just give us a brief description of the model? And also if it's available and if people can use it and how can they use it?
Right. Hi, everyone. Oh, thank you for the introduction. And you give congratulations to me, but actually it's our work. You share the congratulations. And the idea started many years ago. At that time, our papers was always rejected or criticized by the reviewers due to a lack of spatial resolution in the exposure data. We know, as you mentioned, we have known the health effect of radon for many years. That's why in the early 1990s, in the Clean Air Act, a lot of states are required to measure their radon. After that, it's required to report the radon level during the property transaction. This is mandatory in 35 out of the lower 48 states. You see, in the past 20 years, tons of millions of radon measurements have been conducted, but we are still using the old radon map created by EPA based on the data collected almost 40 years ago. That motivates us to improve the model, like to remodel an old house. To remodel old house, we need to have the new material, the new technologies. You see, 40 years ago, the most advanced statistical learning is the linear regression or the mixed effect model. But in the past 20 years, we see the advanced artificial intelligence, and jointly with the massive radon measurements we collected from the collaborators facilitated by Sean Price and Carolina, who is not here today. And we compiled a large national database of over 10 million radon measurements. Using artificial intelligence, we can estimate the association between the radon and some other like geological, meteorological, socioeconomical, and architectural factors. At the end, we can predict the monthly zip code level average radon concentrations for the past 20 years. Based on this data, we can find that in the past 20 years, the average radon concentration doesn't change a lot. I mean, the average concentration doesn't change a lot, but that's not equal to everywhere. In the high radon zones, such as Massachusetts or Iowa, actually the average concentration decreased a little bit, about 3 to 5%. That's largely due to the widespread mitigation. That's the work of a lot of not only academic, but from the private sectors who improve the awareness of radon problem a lot. But for the low radon concentrations, such as in the South and Southeast California, the average radon concentration stays relatively stable. It doesn't change a lot. If we calculate all the populations with their basement or the lowest living level radon concentration, about 4 picograms per liter, which is the safety level or action level recommended by EPA, we can find that there are about 78 million people living in the residence with their radon measurements over this level. That's about 1/4 of the United States population. Most of these people, or most of these residents, are in the low radon zones, such as Florida, California, but radon change a lot from building to building, even across the street. Even in the low radon zones, there are some buildings with super high radon levels. And most of these 48 million people live in the radon zones, low radon zones. So a broader measurements is highly recommended. That's what we learned from our data.
I know that CDC is compiling exactly the same data set. Can you tell us how this is different from the national model? Like, if people want to do exposure assessment, would they go to CDC and get the data, or just link to your database and get the exposures? Are these things different or similar?
We compared our model with the CDC map and with the previous versions of the radon map. We see big differences. And as far as I know, CDC collect data not equal to us. They have a larger database, more data. And I think 20% times larger than us, maybe. But they didn't have equivalent analysis, right? Capacity. They just take some simple summaries and report it, and at a lower spatial resolution. I think that due to their regulation, they cannot disclose the average radon concentration per zip code, or they can only report it by county. And thank you for reminding me that our models, even though it's published, but there's no website for the public to get our data directly. Currently, I have received several emails from collaborators requesting the data. I was very willing to share with them. And currently, we are developing a website to let the public access our model directly. But due to the large data size, it may take a couple of weeks, but it's a work in progress.
Okay, I'm glad I asked you this because I had the impression that CDC just populates the database, but if there are no data for a zip code does not do anything. If there are no data for every year, does not do anything. Whereas your model uses many predictors, over 200 predictors, and basically using extrapolation, you can cover data locations that we have no data. You can cover periods we don't have data, and I think that's important. Especially, there is a difference between a spatial temporal model and just a tabulation of data. Okay, great. I met Matt probably 2 years ago. We were in Athens at the IC meeting, and he expressed me the interest that he wants to work on radon, and back then he was very interested in brain cancer, and since then really has been a very fruitful and collaboration, and I'm really enjoying working with him. He published an important paper that got a lot of press attention, especially from Newsweek magazine, about child cancer. And I would like him to give us the highlights of that paper, which is one of the first of its type to really try to understand the effects on radon on children, especially because they also spend a lot of time in the house. And also we have good exposures, they are 5 to 10 years. So we have a pretty good idea where they spend the last years of their lives. Matt, can you take us through this work?
Yes, I'd be happy to. Thank you, Dr. Koutrakis. It's been a pleasure working with you as well on these studies. You've been the senior collaborator on this work. And thank you, Carly, for the introduction. It's a pleasure to be here speaking about these important topics. So as others have already said on this panel, the more we start to understand radon decay dynamics, the translocation of decay products throughout the body, and the toxicity of alpha particle radiation, which is the main source of and main type of radiation that we are interested in from a health effects standpoint from radon. The rationale for determining whether radon impacts health outcomes beyond lung cancer is stronger. So my current research in this area is focusing on identifying associations between radon decay product exposure and non-lung cancer outcomes, as Dr. Choma alluded to. So other types of cancer besides that. So in regards to this childhood cancer study, this was an ecologic study of radon concentrations and incident or new childhood cancer diagnoses in counties, and counties specifically that reported their data to the National Cancer Institute's surveillance Epidemiology and End Results Program, or SEER. So SEER currently covers about a quarter of US counties geographically, but in terms of population, it's actually closer to about half the population. From 2001 to 2018, in these counties, there were approximately 100,000 cases of childhood cancer. And these cancer data that we had access to were separated by sex and also by the type of cancer. So leukemia, brain and central nervous system cancer, and everything else that was lumped into what they called other cancers. Okay. We linked these annual counts to annual county average radon concentrations in basements or lowest living level. And these were from Dr. Longxiang's Lee and Dr. Koutrakis' most recent model. And then we developed spatiotemporal statistical models that accounted for factors that were related to locations, spatial locations over time. So what we found from this modeling effort were associations between county average radon level and higher risk of leukemia in both males and females ages 0 to 19 years old. These results were robust to many different sensitivity analyses. So for leukemia, we specifically, we found associations with radon concentrations above 2 picocuries per liter or 74 becquerels per meter cubed. That's the threshold at which the US EPA advises homeowners to consider mitigation. It's the first step in their sequence of action levels. Okay, the other level that Dr. Lee mentioned is the 4 picocurie per liter limit, above which the US EPA recommends mitigation for radon. So we found this link between a common non-lung cancer in children. And this is an important finding, not previously shown such a wide scale in the US or even in North America. And we did not find any associations between radon and other types of cancer at the county level for children, but we acknowledge that some of these other cancers may still be linked, and future research needs to help us determine that.
Thanks, Matt. Tina and I, we have been collaborating on a kind of series of studies called SICAS, which is a cohort that includes inner city children in Boston, mostly from disadvantaged family background. Sorry, from minority background, Hispanic and Black. And the goal was to study the asthmatic effects of these children. They have high incidence rate. So most of the work that the people at the Boston Children's Hospital have been doing with this cohort is to study asthma and respiratory. But we worked with Tina a couple of years ago and provided her the radon data. And this kind was new and exciting, and Tina has been able to publish 2 or 3 papers. So maybe you can describe us your work and how, and if you were surprised to see that asthma is related to radon, because that's not something that we know.
Yeah, thank you again for the invitation to be part of the panel. Until recently, little was known about the effects of asthma, of radon on asthma morbidity. While radon is more well known for its effects in cancer, more recent data in adults suggest an association with radon and COPD. So given this recent data showing that association between radon and non-cancer related COPD, our group hypothesized that radon would be associated with asthma morbidity and increased airway inflammation. So in the school inner-city asthma study, or SICAS, using the spatiotemporal radon model developed by Dr. Lee and Dr. Koutrakis' group, we found that radon was associated with increased airway inflammation and asthma symptoms in school-age children with asthma, where we showed a temporal association of radon exposure with increase in asthma symptoms and a seasonal relationship with FeNO, or fractional exhaled nitric oxide, a marker of eosinophilic inflammation. In more recent work in the SICA study, we identified biomarkers associated with radon exposure, and we found that radon exposure was significantly associated with increase in interleukin-5, a biomarker of inflammation, and that IL-5 is part of the causal pathway between radon exposure and absolute eosinophil count in patients with asthma. And this may help in phenotyping patients and identifies potential mechanisms important to this exposure outcome relationship. Another thing to note is that the levels of radon in our study were all greater than the natural outdoor level of radon, that the level that US Congress has set as the target indoor radon level, the lower compared to the EPA recommended action level advised for indoor radon mitigation. This suggests that possibly radon is a potential important contributor to asthma morbidity at levels below existing EPA guidelines that were developed specifically on lung cancer risk associated with radon.
Thanks, Tina. And I think you mentioned this again, that it's kind of, it shows up most of the time that we see effects below the 4 picocuries per liter. So I think hopefully when we have enough studies, EPA will move and try to reduce the guidelines. It's not even a standard, it's a guideline. And I think we're going to hear from the experts in a few minutes, which really takes me to Sean. Our team, most of the work we have done, it's in particles, ambient indoor particles, air pollution, health effects. So we came kind of new to this area, kind of serendipitous. We tried to understand why particles kill. And one of the hypotheses we developed is because the radionuclides that they attach to particles, whether you are inside the house or in the ambient air, and these are the ones that they cause the effects, as Matt said, alpha emitting radionuclides. So we kind of came to this field, to radon, just because we were trying to understand particle toxicity, and since we have been able to work with Sean, and with actually somebody who has worked for many, many years in this area, and we have learned a lot, and also he really has helped us and introduced us to other big companies and people who really know this field very well. So Sean, I know you run a business, and I know that's important, but I would like, but I must say that you really care about this radon, and you have many activities outside your kind of business world. So I would like to ask you 2 questions. The first is, what kind of services your business, Bruce, and other provide in the United States? And the second is, what kind of stumbling blocks, what kind of problems you see while you're trying to really mitigate homes, work with builders for new, for new homes? How are you encouraged that, do you think we're making progress, or we're just kind of going slowly over the years?
Well, thank you, Petros, and thanks again for the invitation, and congratulations, Longxiang, on all of the work and the publications that you've been able to do. It's nice to see our hard work that we do on a daily basis put to excellent use. So, within our company, Radonaway, we offer tools and equipment that are used by all the professionals around the country, and sometimes in other countries as well. So we make the inline fans that mitigators will use to draw the suction underneath the foundations, line crawl spaces, so they can get concentrated suction on the soil to try to prevent the radon from coming in. We also make electronic monitors that professionals use to test during, say, a real estate transaction. And my main focus is the laboratory. So we offer radon test devices to people that are promoting, radon education and awareness, maybe the state health department, your local county, Health Department, the American Lung Association. So we're distributing test kits for that purpose. Home inspectors that are doing radon testing during a real estate transaction are getting equipment from us, and also school testing, multifamily testing. So we're seeing tests all around the country for many many types of test motivations of, I want to know it's a problem. I saw a PSA. I ran across your website. Whatever the reason. So it is one of those things that is misunderstood, and I've had thousands of conversations with concerned homeowners, with real estate agents, with builders, and and oftentimes some of those conversations was, is radon still a thing? I thought that was just something that came in like the 1980s, 1990s, and that it was all fixed. So there's that education piece, and that's where it's fun to talk to those people and educate them one at a time. And when you reach out and you talk to a family that has lost a loved one from lung cancer, or maybe it's the person fighting cancer themselves, it's far more than a job at that point. It really becomes your life's work. My wife has been in radon. My daughter works here in the laboratory. We've done Relay for Life teams, Team Radon, and it really is a passion. And it's good to see our work being published and by people far smarter than we could ever do at the laboratory. It's nice to see that. And that's the type of effort that we need to really change policies. So, how have we been doing over the years? In the early 80s or mid 80s, early 90s, there was a lot of education. And then in the 90s, it started moving over into real estate transactions. States started requiring testers and mitigators and laboratories to have licenses, which added to our credibility. It made our jobs, accountable. And, so watching all of that growth, but we're still, there's so much more that we can be doing. So I think it starts off with the science to see these other, health related possibilities, linked to radon exposure, radon decay product exposure. You talk to scientists, there has to be more than just lung cancer. As if lung cancer wasn't bad enough on its own, all of the other things, the leukemias, the Alzheimer's, the Parkinson's, what else might it be? So, I think it's still an education. It's a work in progress. In some of the states where we find the highest radon, those programs are very mature, and there's a lot of money being spent to educate the public. But that means there's 30 states that radon is still just not talked about enough. One of the fortunate things is in the last 10 years, we've done a lot of multifamily testing across the United States in areas that were very under tested, and lo and behold, we're finding radon. So the only way not to find it is not to look for it. So if there are any ways that we can promote testing, we're going to continue to find it. We're going to educate, and I would love to see some national building code improvements. I would love to see builders accountable. We can't say we didn't know that the building was going to have radon in it. We've known for 35 years, if you build the building properly, you can prevent radon from ever becoming an issue to begin with. And we're just not quite there. We've made tons of progress, but we've got a lot of work ahead of us. And it's nice to see that there's a lot of people helping pull the wagon now.
Thanks, Sean. One brief question. How do you I mean, you have many materials like countertops and others that they produce radon or how do you deal with those? I mean, are we ready to start thinking about sources other than the basement? Do you worry? Do you think that's a big that these materials contribute a lot to exposure, to the total exposure?
Okay, yeah, excellent question. Now, it was about 12 years ago, there was a lot of news stories about radon in granite countertops. And while it's true, I can measure radon coming out of a granite countertop. I've yet to find a granite countertop that was high enough to be a source of radon that needed to be mitigated. However, concrete, if you're living in a concrete cube, and you're thinking about all of these very, very weather-tight condominiums and apartment complexes, it used to just be Florida. You've got some radium in the concrete mix, you know, and you've got a recirculating heating and air system that's not bringing in fresh air. It's very common to find high radon in upper floors that is not related to the soil gas. That the key there is ventilation. So fresh air and dilution is really the key there. We don't have to screen concrete. It's not, you know, weapons grade concrete by any means, but a little bit of radon goes a long way when you trap it and the walls and the floor and the ceiling are made out of concrete. And so that Florida problem, we've seen it in all the way up the south, from the southeastern coast. We've seen it into Tennessee, Indiana, and the recipe is you're living in a very airtight concrete building, and the mechanical engineers did not design enough fresh air into the air conditioning system. And you can have low radon on the first floor, and you can have high radon on the 15th floor.
Okay. Now let's move to policy. Jane, you have a lot of experience in this area. Do you think that EPA, CDC they do the right, they have developed the right policies to reduce risk? Sometimes my own experience, before you give us your opinion, which probably is more sound than mine, but is try to deal with EPA and radon. They basically, the message was, we know radon and we have dealt with radon and we don't want to know anything about radon. So that's my kind impression, but probably your opinion counts more than mine. So can you tell us a little bit more about, you know, the national policy? And I know you have prepared some slides, and Carly or you can share them if you. I think you have the. Jane, are you?
First of all, can you hear me now?
Yes.
Okay, sorry. So first of all, on EPA, I mean, you know, President Reagan signed the Indoor Radon Abatement Act in 1988. And basically that created an important framework that EPA indeed filled out over the last, 30 plus years to, they really created the foundation for standards, for example, where they, had the resources at the time, did the research and developed standards. Today, EPA no longer takes the lead on that, but is a key partner in the public-private partnership to develop and maintain radon standards. They had the first national proficiency program, unfortunately, because of things that happen in different administrations to federal budgets. EPA's resources were cut back, and basically private proficiency was privatized over to what we call now today the National Radon Proficiency Program, the National Radon Safety Board. But EPA plays a role still today in providing the framework to recognize what is a good program. And they're in the middle of finalizing what we hope will be a brand new generation in terms of EPA oversight of credentialing programs for radon. With respect to the 1993 map and the 1992 survey and all that old stuff. It's, evident that EPA, after, the late 90s did not have any resources to do anything useful in terms of data collection or risk assessment. I mean, they've been doing some back of the envelope risk assessment, if you will. Every time a new study comes out, they redo their analysis to try to look at, for example, the cost benefit of intervening in radon. But they don't have the resources or role with that, which is why it's been so important to see CDC, Center for Disease Control and Prevention's Environmental Public Health Tracking Network come forward to include radon under its umbrella and to begin to develop over the past 10 years the system that is in place for receiving and publishing results of radon testing around the country. We are, actually, our organization is supporting a new radon data collaborative that will help to update the CDC data fields and also establishing a uniform data standard through which all entities would start meeting the same mandatory requirements. Because if you look at radon data, what we have out there, there's a whole bunch of great ideas for what one could know about a building. And yet, in most of the data sets, all you see is, basic information. Yet you can get down to the county level, maybe, but the whole variability in terms of the buildings and the circumstances, whether they're multifamily or single family, there's a whole bunch of factors that aren't well captured by the current system because there aren't really expectations to deliver that data. So we're looking under the Radon Data Collaborative also at a unified data repository that would be public-private sector, be something everybody could participate in, which would link strands of data for the same tests and also manage geocoding and deduplication, both of which are a big problem in the current data sets. And similarly, CDC's chronic disease programs, cancer control grants, they could play a pivotal role, and some of them do now, in advancing radon risk reduction through recently, and we have a new set of evidence-based interventions or EBIs, which we're looking to the state radon programs cancer control programs to take a lead on. HUD is a mixed bag. There's a great multifamily lending policy. I mean, it's the model policy for the nation in terms of testing, requiring testing 100% ground contact units and mitigation of those that are high so that the building is safe from radon, not unit by unit. However, FHFA, which oversees Fannie Mae and Freddie Mac, when they developed a similar policy and published it a couple of years ago, it's not as strong a policy, so we're hoping to see that improve over the next couple of years. And I wanted to just briefly share
Yeah, I think you can.
Is that okay?
Yeah.
And let me just pull this together so I can, here we go, hold on.
Yeah, you can see.
Here we go. So these are the next few slides you're going to see are US maps with state radon, with basically state policy data. So first of all, here, radon notification and disclosure laws. First of all, note the pale blue counties don't have any policy. The golden ones have what we consider to be the best policy, which is notification and disclosure. The two green states, Colorado and Illinois, they're warning both tenants and home buyers about the possibility of radon. And then there are some other states that have a disclosure only policy. Those are those purple states. But good news, the North Dakota Senate passed a bill the other day that's headed to the House, and we're looking to North Dakota soon having a policy there. Similarly, there's a bill been introduced in Indiana, which will be doing both notification and disclosure. So it's not just the simple disclosure. Radon control for new homes. This map, all those gray states, those have no policy at the state level. The green states have, considered the best policy, testing all zones, all radon, all the old EPA radon zones, and testing all types of homes. The blue states only test the states that are, in counties that have the EPA, area 1. And there's some other variability, but you can see the paucity. We only have 12 states that have anything on statewide control in new buildings, something that Sean talked about, just so important. Radon testing in schools, a lot of people ask about this, it's children's exposure over life. You can see here again, we have a patchwork. Sadly, well, it's bad that there's lots of states that have requirements, but there are states that have a policy, but they don't require it be implemented according to any standard like the NCR standards. There's 2 states that require testing and mitigation, but we've got a lot more work to do in the schools. So those 3 slides were about what I call occupant protection policies, and they're so important. But underneath all that, who's doing the work and is it being done right? This map talks about radon credentialing policies, and you can see we've got several different flavors. Again, the flavors, the pale blue states have no policy. The gray states only requires, sorry, the gray states require certification plus a state credential. And the orange states are certification only, which have the lowest level of enforcement. And the purple states here, purple's a different meaning in this map. They're the states where we're seeing new laws come about. We've already seen bills introduced in New York and Missouri, and there are folks working hard in Maryland, Wisconsin, and Tennessee to make that happen as well. You know, our organization has the opinion that it's not a good idea to enact those occupant protection policies when you don't have this infrastructure in place. So there's no one paying attention to how the work is being done and sort of having expectations around, you know, qualifications at the get-go or compliance with standards. And then this last map is the aspirational map, where we're looking at different efforts that have been introduced and discussed, and some of them you've seen already. But on the left side, you see the different flavors of policy that people are looking at today. And we look forward to progress on all this during 2025. Sorry, that's the end of my share. I'm trying to stop sharing. There you go.
Yeah.
I'm sharing. Thank you.
You're welcome. Now we will move to the last panelist, who's Stacy Stanifer from University of Kentucky. They have a great, actually one of the few groups in the country that do serious radon work, and Stacy is the director of the BREATHE program, which is a radon policy program. Stacy, tell us more about your experience, you know, how you approach the community, how you make people pay more attention, how you can really use your scientific information to empower the community. You are one of the few people that is out there trying to make things happen, you know, where what we call implementation science. So can you share some of that experience with us?
Yeah, thank you, Dr. Koutrakis. There's a lot of work to be done in this area. I think we can all attest to that. Community engagement really for us has been a really powerful tool for increasing public awareness and action on radon exposure. In Kentucky, which also happens to have quite a bit of radon risk potential and incidentally leads the nation in lung cancer incidence and mortality, we discovered the mean annual home radon testing rate for Kentucky was really low. It was at 13.4 per 10,000 households. So greater radon awareness and action in our state is really needed. And through our community engagement efforts, we've been able to develop interventions that can be tailored to meet the needs of the communities that we serve. So in our project, which is called Radon on the Radar, this was a NIEHS funded project. Radar is actually an acronym standing for Residents Acting to Detect and Alleviate Radon. We engaged community partners in 4 different rural counties of Kentucky. We recruited 15 citizen scientists in each of those 4 counties. And prior to our study, each of these counties had very low testing rates, ranging anywhere from fewer than 1% of homes to the highest at 9.8% of homes having been tested for radon. With our community partners and our citizen scientists, we designed a radon detector kit library lending program where digital home radon detectors were placed in the public libraries and made available for checkout, just like you would a book. the traditional, in the past, our state had previously had the short-term radon test kits available, and some of our health departments throughout the country or throughout the state had those available for folks to check out. But the uptake of those was very low. And so having these digital detectors in the libraries was a wonderful opportunity to do that, initial kind of first check to see what the radon levels were in homes. And if they ended up being high, folks were then directed to contact our professionals in the state. But having them available at the library where they could check out just like they would a book proved to be really beneficial. When we're working to improve public health, libraries are really wonderful partners because they have few barriers to access. So nearly everyone can get a library card in their community. And we made these available for anyone who is over the age of 18, as long as you had a library card. In our study, our partners and our citizen scientists were really integral in the design of the program. They helped us with messaging, they helped us with marketing, and they also helped us with the evaluation of the program. And that proved to be really helpful because I live in central Kentucky, have never lived in the 4 counties that were involved in our studies, but having their input on how messages get out, what messages would work in their community, who would be somebody that's influential in their community that we should engage with and try to get them on board for helping spread the word about radon was really helpful. And our data from the study shows that in these 4 counties, when we compared pre-library loan program testing rates using charcoal-based test kits to the checkouts at the library, we saw a 249% increase in home radon testing. And I believe that the community engagement was really key to the success. Now we have many of our citizen scientists who are part of our local health coalitions, and they're ensuring that radon stays on the agenda of those health coalitions within these communities. And for example, we had several last month who approached their town mayors and also the county judge executives, and were able to get National Radon Action Month proclamations from those folks, which then ended up making it into the local newspaper, which then drove more folks to the library. So I think community engagement can really be a wonderful way to increase public awareness that is tailored to those communities.
Thank you. I had a second round of questions, but probably we need another webinar. I had some challenging questions. The first question was, what kind of science we need to do in order to have a better risk assessment for radon? The other question was, how can we improve exposure assessment for radon in terms of, starting to introduce data on, vertical and individual building information. And the other question I had was, it's really difficult to do cancer research, and we are finding this now, all of us, that Matt and I, and so I think we really need to make sure that the cancer data we have, the cancer registries, they become available. I know there are sensitivities and personal information that cannot be disclosed, but we cannot really do epidemiology with county level cancer. We really need to move down to a smaller, now we have the radon model goes down to zip code. So I would like to end this webinar by talking about a very prominent researcher and academician who really led this research, the radon research in this country, that left us very early. Professor Bill Field was one of the really fathers of radon research. I remember one day I received a message from him. I did not know him that much. He said, well, please keep up the good work on radon. And since then, I tried to learn about him. And by the time I wanted to meet him, he left us. So I think Stacy and Jane know him, and maybe they can say something and reflect upon his big loss.
Yeah, I'd be happy to. just real briefly, Dr. Field was a wonderful mentor to me. I reached out to him during my doctoral studies, and he turned out to just be a fantastic resource. And as much as he's accomplished in his life in this field, he always seemed so humble to me and really was a fantastic mentor, everything that you would want in one. I think that for me, being a nurse, he really valued the impact that healthcare providers can have in this area. And so he was willing to mentor me in that respect. And you can also see that the Conference for Radiation Control Program Directors has their guide for healthcare providers. And so I think he really valued healthcare's role in improving awareness around radon. And yeah, was very sad to lose him so early on in my career. And but his impact lives on in all the research that he has.
Jane, you want to give a brief
Sure.
reflection?
Just reflecting on his work in memory, he anchored multiple epidemiological and technical research efforts. He also served on key advisory boards within the U.S. at the World Health Organization. He was really out there on the occupational front, serving on the president-appointed panel for occupational exposure to radon for many, many years. And he was actually also on EPA's Science Advisory Board until that was purged at some point in 2018, I think. And he was key part of the World Health Organization effort to, identify what should be the national radon reference of, as we know, 2.7 picocuries per liter. And his leadership and mentorship, his personal mentorship, were instrumental to so many people, extremely valuable to our organization, including myself, and many other stakeholders. And just one last point is that he also worked with us on what's still an unfinished project, which is an attempt to figure out how we can reduce the radon action level in the U.S. And he played a key role in that. And then finally, I just want to mention, his conclusions come back to us all the time. One of the things that he discovered more than 10 years ago is that in the case of radon and smoking risks, the inclusion of smoking information can reduce the impact that message can have on non-smokers. And as we keep pushing out that smoking message or the combined smoking radon message, we're actually distracting the non-smokers from the main message. He did that work under a study sponsored by the American Health Psychological Association. And finally, he also tried hard to help advance reform of the OSHA radon standard, which he referred to as in an article as a 50-year-old scientifically indefensible radiation standard. Bill was just a leader on so many fronts. And he also, by the way, was a keynote speaker at many of our symposia, as well as regional meetings. He was out there helping everybody to get it, to figure it out. His top 10 points webinar slides are still the classic in terms of summarizing what we face today. Thank you.
Thank you so much. Thank you. We're about to end this webinar. We have a question that is the person is asking what we think about air quality monitoring that people use for their homes, and for example, radon, carbon dioxide, VOCs, etc. I'll answer this because that's my kind of expertise. I think some sensors are less accurate than others, but they are better than nothing. And when it comes to radon, I think they're pretty accurate. With a couple of $100 now, you can get different companies. I don't want to do an advertisement for specific companies, and they're pretty accurate. And actually, I had one and I gave to 10 different people, and they found they have problems they mitigate. So yes, let's use sensors. Let's try to educate, and Stacy said about this. So yes, they're good and they're better. They are not to do very accurate, assessment of exposures, but they're pretty good to identify problems. And I think we are, unless Carly wants to tell us something, I think we're about to end this webinar. I really thank you. I know you have many things to say, and in this short time, So probably we can have another discussion in the future. I am very optimistic. I think I see more researchers coming to this field now from different universities. I saw NIH has funded a couple of 2-3 radon R01s elsewhere in other universities. So I think, with this kind of work, the people will pay more attention. And I think that we are going to learn a lot. And hopefully this information can be translated to policy. And again, thank you. Thanks, Carly, for organizing this. And we can say goodbye and end here. Thank you. Thanks.